what we did was to build a quality culture. The quality culture amongst the people, both leadership and every other staff, so that everyone under the umbrella of Fidson has an understanding, has an awareness of what quality is all about. We are driving our processes to ensure that quality is built in, not at the end of when the product is manufactured, but at the beginning, when you are developing the product. You look at what it entails. You look at your vendors. Such vendors, you now have to qualify them. You have to audit them. You must ensure that every material that still comes into the system is tested. And we use international pharmacopoeias, reference books, that give us a guide. This is the test you're supposed to take. So we carry out tests. We now certify and give it an approval that we can use it for our manufacturing. At the point of production, there has to be some documentation for which you will generate, and you will walk through building in quality, be it at dispensing. You will verify that every material that is supplied is what it is. And because quality is built into the product from end to end, meaning from the beginning of which the materials are received to the end point, this signifies the point where we receive materials into the factory and we place them under quarantine. Each of the material here are placed separately with different batches according to the different materials to ensure that there is no mix-up of materials, there is no mix-up of batch information, and every material here is received with a report that we call a material receipt report. Because you're talking of the quality culture, it has to do with the people. You're looking at people who are recruited based on their skills and technical competence. You now have to take them through consistent, frequent capacity building and training to ensure that at every point in time, they are at par with the international expectations in terms of the standard. And you know one thing about quality is not static, it's dynamic. So you have to continually evolve with the improvement of understanding and the expectations on cGMP. That's our focus. cGMP, WHO guidelines, ICH guidelines, NAFDAC guidelines too. Every requirement in terms of GMP expectation is built in this continuous training and capacity building we have for our personnel. So we have to take our staff through that capacity building to ensure that they are consistently delivering quality products to the consumer. So we are still talking about the quality culture. The quality culture also, we are now looking at the facility. You're looking at the system. They're looking at, okay, what have we put in place to ensure that the system is fit for purpose? Every process of Fidson Healthcare is a process that has been defined in line with cGMP. What is cGMP? cGMP is current good manufacturing practice, meaning it is the current trend on the expectation of the delivery of quality products at every point in time and continuously. These are the things that guide us. I say guidelines, we rely on them strictly as guides so that we can adopt a system that meets all processes that are able to be compared with global best practice.